southern border would likely increase the strain on health systems in our border communities, taking away important and life-saving resources from American citizens. Tonight, again at midnight, we will execute the CDC order by immediately returning individuals arriving without documentation to Canada, Mexico, as well as a number of other countries without delay. And so, again, CBP is positioned to execute these measures as we continue to keep our borders secure and safe. Before I conclude, let me just wrap up by thanking the brave men and women of DHS, specifically CBP, and across the government for the work that they do day in and day out to keep the American people safe from the coronavirus. The department has a number of frontline officers that have tested positive, as well as others who are self-quarantining. And that I am doing everything that I can to protect these patriots as they continue to defend our homeland during this crisis. Thank you.
Thank you very much, David. Thank you.
Today's announcement is just the latest in a long line of bold, decisive actions the President has taken to protect Americans from the coronavirus spreading across our borders. In January, within 2 weeks of China's notifying WHO about the virus, and with only 45 cases in China, we began screening travelers from Wuhan. Then over time, as the outbreak evolved, the President restricted travel from China, Iran, and Europe. Our health experts say that these measures have been truly effective at slowing the virus's spread to our shores. Just think about this. Italy and the United States both saw their first travel-related case of coronavirus around the exact same time, the last week of January. And yet we have had precious time to continue our work around vaccines, therapeutics, and other preparations, while Italy has tragically been overwhelmed with critical patients for several weeks now. The President today is taking action to slow the spread of infectious disease via our border. Under Section 362 of the Public Health Service Act, the CDC is suspending the entry of certain persons into the United States because of the public health threat that their entry into the United States represents. This order applies to persons coming from Mexico and Canada who are seeking to enter the country illegally and who would normally be held in a congregate setting like a Customs and Border Protection station. It does not apply to U.S. citizens or lawful permanent residents. During this pandemic, a number of health challenges arise when illegal immigrants arrive at our northern and southern borders and are taken into immigration custody. We're talking about significant numbers of illegal immigrants. From this past October through February, DHS has processed more than 21,000 inadmissible aliens at the northern border and more than 151,000 inadmissible aliens at the southern border. CBP facilities were never designed to hold large numbers of people and to protect agents and migrants from infection during a pandemic, nor to treat them for a novel virus if large numbers are infected. When held at border facilities, these migrants risk spreading the virus to other migrants, to CBP agents and border healthcare workers, and even the United States population as a whole. In such circumstances, the kind of social distancing measures the CDC